and I'm going to present to y'all Irex Immersive Rehabilitation Exercise System, and this is created by Gesture Tech. Go to the next slide. So what does Irex do, what does it utilize, and what does it completely do? So Irex utilizes unique technological features such as the right there, and then their own computer program. It displays real-time live full body imaging of the patients onto the television. And this is where the patients are immersed into virtual reality video games. This system evaluates patients' movements throughout their exercises, and it specifies rehabilitative exercises as well. You can go to the next slide. So what are some of the technological features? First, we have the image tracker. The image tracker actually allows the camera to automatically find the patient during the exercise. Next. The virtual goniometer. This provides real-time live range of motion measurements throughout their games. The virtual teacher gives reference points to the patient and an instructional model as well. And then visual and audio biofeedback. So as you can see, this patient's wearing some goggles, virtual reality goggles, and this is where they're actually immersed into the video game, and it's more live. And they can also wear headphones too, which will even further enhance that feedback. Next, yeah. Recording and protocol customization. This allows the clinician to receive and utilize data and build custom protocols for their individual patients. And then there's several games available. There are over 20 games available for Irex. As you can see, you have bowling, they have volleyball, they have simple activities of daily living like taking a box off a shelf, and then they have paragliding, which I think is kind of silly, but it is effective. Next. So what's a good example? I chose to do the virtual reality soccer game, and the goal of this game is simple. It's just to prevent the balls from getting into the goal. It actually is able to focus on a couple different things. It focuses on balance, flexion. Which one? Oh, it's a
very top button is a lead.
Oh, okay, cool. I got it now. So it focuses on balance, flexion, abduction, exertion, and timing. This game would be very good for people and patients that are recovering from shoulder surgery or other shoulder pathologies or injuries. So one case study I found was about stroke patients. It had 30 patients involved that used Irex and 29 patients involved that just used traditional rehab. And what I found is that both groups met the minimal standards on recovery time. However, patients that used Irex, the treatment group, had a reduced impairment in their lower extremity, which was a 4% improvement immediately after training. And then this was measured by the Cherokee McMaster Stroke Assessment Scale leg domain, and that's just a simple stroke test that they do to measure with their patients. So stages of healing. I had someone ask me, what stages of healing is Irex appropriate for? And what I found from reading on their website and some of the research that I did is that it's important to incorporate Irex during the subacute inflammatory phase, and that patients must also have full range of motion to begin. So pros and cons. So pros, so you have improved cortical reorganization. That's simply just, they're regaining their neuromuscular control. Improved balance and trunk control, so they improved proprioception. Increased sense of control, achievement, and independence. So the patients are actually more confident through all their exercise bouts. And then an increased enjoyment and desire to engage. The patients are having fun throughout these games and exercises, so they're able to not so much focus on being, I guess, bored, but more so to focus on like having fun and let the clinician do his job. And then a pain diversion. Like I said, the patients are having fun throughout their games and exercises, so they're not really focused or worried about hurting a little bit. So cons. So possible re-injury due to a couple different things. You can have overexertion. The patient may possibly overexert themselves. Say if they're playing the soccer game, they may go like way over here when they just got back from shoulder surgery and then it's got cleared to use this system for rehab, and that's just not what needed to happen. Incorrect input data. Like I said, if so you're playing that soccer game and the clinician can actually put the soccer ball in certain angles. They can specifically place the soccer ball to go certain places, and they tell the patient you need to block the soccer ball with your right hand, and they put the ball way over here, I mean, we all know that's completely inappropriate for that patient who's recovering from shoulder surgery. And then a poor clinical assessment. The clinician just thinks the patient's ready to use Irex. However, they're really not at this time, and that's just where you have to be able to fine-tune your skills as a clinician. And then an incomplete simulation of activities of daily living. In a video game, you cannot completely simulate what we do on a daily basis. It's just not, it's not possible. And then the price is relatively expensive. It's $14,000. However, when you compare it to other high-tech systems, this is actually this can be said to be relatively cheap. However, since it's $14,000, that's definitely a con in my opinion. And then conclusive results. So patients are 3 times more likely to use Irex over their traditional rehab programs. They last 2 to 3 times longer with Irex compared to other traditional rehab protocols. And they're adaptable from the highest to lowest functioning patient. So the neurologically impaired can use this, stroke patients, general and sports-specific patients, pediatrics, people with autism, and cerebral palsy. And that's it. That's all I have. These are my resources. Does anybody have any questions or anything they want to ask?